I'm just going to give everybody a minute or two here to jump on, and I'll introduce myself and start discussing some tips for squat performance today. Alright, it looks like some people are jumping on, so I'll go ahead and get started. My name is Ryan Fitzpatrick. I am a physical therapist and clinic manager at CORA Physical Therapy in Wilmington, North Carolina. If you tuned in last week on Facebook Live, I did a previous Facebook Live on intention and different forms of exercise and how to stay active during this time. Today, what I want to discuss is some tips to improve your squat performance. And I'll do this by essentially going through a self-movement screening that you can perform at home. And I'll also break down some common terms that are used, for example, flexibility, mobility, and stability, to gain a better understanding of what those terms actually mean and how they contribute to your squat performance. So to get started here, what I'm going to do, let's just break down those terms right off the bat. So flexibility is the ability of soft tissues, or in this case we're talking muscles to move passively through their full range of motion. Now this is different from mobility, and a lot of times you'll hear those terms used interchangeably, flexibility and mobility. However, those are two different terms with different definitions, although they do work together to promote quality movement. So, like I said, flexibility is the ability of a muscle to move passively through its full range of motion, whereas mobility is the ability of a joint to actively move through its full range of motion. So that's the deciphering factor there is the muscle passively moving versus the joint being able to actively move in order to move well. And then the third term I want to define is motor control, also known as stability. This is an individual's ability to control a movement through the full range of motion. Now, somebody may have full mobility, full flexibility, however, they do something like a squat and they can't seem to quite optimize that movement pattern, and that may be because they are having difficulty controlling the movement. They have the prerequisite mobility, but they can't quite control that movement through the full range. And now that takes me to strength, which is the ability to produce a maximal force throughout that range of motion. So flexibility, mobility, stability, and strength are all crucial factors that come into play when we're talking about something like a squat. And this can range all the way from a body weight squat all the way up to someone loading up a barbell squat with a back rack, front rack, or overhead squat. So what I'll do next, and if anybody has any questions that come up along the way, so you don't forget, you can kind of post them here, and I'll try to get to those at the end if we have time and answer those. So now that we've defined those terms, what I want to do here is take you all through a self-movement screening, basically going joint by joint, but in a way that we can kind of break down and try to figure out, if you're doing this at home, what may be limiting your squat, or looking for any asymmetries that you may have from side to side. And the goal here is to promote pain and injury-free squatting, and also for those of you who are trying to increase load and become stronger, to squat pain-free, injury-free, and improve your performance while doing so. So let's go ahead and get started with that. So the first thing I'm going to do is I'm going to demonstrate an overhead squat. An overhead squat is a global test of mobility and stability. So everything has to be working together here. Like I said, flexibility is where the muscles have to passively move through the range of motion. Joint mobility, meaning actively being able to move up and down through my hips, my knees, my ankles. As well as control. I have to be able to have that motor control and stability to be able to go up and down without, for example, losing balance. But what we'll do here is I'm going to start off with a dowel. And I'm going to place this dowel all the way up overhead, right here. I'm going to get in my squat stance, and then I'm going to squat all the way down, come back up, do a couple of reps here. I'll also do this from the front so you can see down, up, down, up. So what we're looking for here is, and you can do this at home with anything, a broomstick, anything like this to hold overhead. What I'm looking for here is, as I'm coming down, am I shifting my torso forward in order to get down here? Am I, if you look at it from this angle, am I shifting my weight to the right or to the left? Or am I rotating at all? When I come back up, do I feel like I have to cave my knees in to get back up? The other thing we're looking for is the ability of the hip crease to go below the knees, or in other words, going below parallel. So right there and below. So we're looking at all of those things, and what you might notice is you may notice one of those faults that I just mentioned, and what this self-movement screening is going to do is help to break down joint by joint what may be causing some of those limitations. So first thing I'm going to do now is I am going to take away the overhead component of the motion. So by doing something overhead like this, I'm engaging everything up here. We're going to take that out of the equation, and then you're just going to try it at home, just try an air squat. So no overhead hold, you're just going to do a body weight squat, down and up, body weight squat, down and up. And what you're paying attention to is, were you able to clear some of those movement patterns that you found were a little bit faulty? Were you able to clear up and get lower in your squat? If that is so, if that's the case where you felt you were much more comfortable, you were able to perform the squat to full depth, what may have been limiting you there is thoracic, meaning mid-back extension potentially and rotation. So especially when someone's performing overhead squats, it requires a lot of mid-back mobility as well as shoulder flexibility up here. But a little test for that to see if you have adequate thoracic spine mobility into extension and rotation would be to get on all fours here. And what you'll do is rock your butt back towards your heels, come down to here, and then hand behind your head, and you're trying to rotate up and out. And what we're looking for there is, the big thing is, it's going to be tough to see without a clinician actually gauging your range of motion. Doing this at home, the biggest thing you're looking for is a major asymmetry that you feel from side to side. So maybe doing that test, you felt like you were more stiff rotating up and back one way versus the other. And the deciphering factor there would be determining if it is a true mobility issue, meaning your joints aren't moving as well as they could be, or is it more of a motor control or stability issue where you have that range of motion there, you just can't access it and use it well. And that would be something that may be worth going in to see a doctor of physical therapy about, or going in and getting a free movement assessment done. We do offer those at CORA, so you can come in, free of charge if you just have some questions about your movement patterns, or you're having pain with some of your movement patterns. We could go ahead and take a look at that for you and maybe start to break that down a little bit further. Now, the next step here, you perform your overhead squat. You just did that test with the air squat and your mid-back, and you found that wasn't your issue. You're still having trouble with your squat, even taking that out of the equation. So now let's go down and look at the ankles, all right? So what I'm going to have you do is grab something to elevate your heels up just a little bit. And you're going to place that on the ground, and what you're going to do is you're going to put your heels up onto that elevated surface, which I'm going to demonstrate here. So you're back into your squat stance on the elevated surface with your heels. You're going to hold this back overhead, and you're going to squat. Now, what you're looking for there is to determine whether you felt like, oh, I can much more comfortably go down to full depth, I don't feel unstable. I was able to keep a nice upright torso, so I wasn't dipping forward. I was able to stay upright. I was able to keep my dowel right over the middle of my body, over the middle of my foot. Now, what we're looking at there is potentially maybe you are having some limited ankle range of motion, which is very common with many folks I see here in the clinic. Ankle mobility and soft tissue range of motion is huge in being able to squat comfortably into a deeper position. So what we did by elevating our heels up is kind of made up for that. And that's why if you found, okay, I can squat much more comfortably like that, it may be because you do have some limited ankle, what we call dorsiflexion. And so a quick little screening test to see how your dorsiflexion is from side to side, I'm going to show you here, is you're going to go down into a half kneel position in front of the wall. So you're going to be here, and what you're going to do is you're going to keep your foot flat on the ground. And what I want you to do is go approximately 3 inches away from the wall. So from the wall to your toe, 3 inches. And then what you're going to try to do, keeping your heel on the ground, you're going to try to bring your knee to the wall. Like that there. If you're able to do that successfully, I want you to move back about to like 4 or 5 inches away from the wall. And then what you'll do is try that same thing. Try to bring your knee all the way to the wall. Now, the keys here is because you can cheat this test pretty easily by allowing your heel to pop up when you're bringing your knee to the wall, or by going onto the inside of your foot and your knee caves in. So you may be able to get to the wall that way, but that's not true ankle dorsiflexion. That's just compensating to get to that point. So you want to really make sure your knee stays right over your toes, bringing it in. And a good rule of thumb is being able to bring the knee to the wall without compensating about 3 to 5 inches away from the wall. And it's going to differ a little bit based on body type and lever arms and things like that. But that's in general 3 to 5 inches away. If you can bring that knee to that wall, your ankle mobility is pretty good. If you're unable to, maybe that's where you need a little bit of work, whether it's your actual joint of your ankle that needs to move better, that mobility, or whether it's the soft tissues, the muscles in the backside of your calf that need a little bit of work in terms of flexibility. Now, beyond kind of testing the ankle, we need to also look into, well, actually I should say, make sure you check that test side to side, because we're always looking for asymmetries. That's the key. A lot of people have like one side that's very mobile and moving well, and another side that's not, and that's where the big discrepancy comes about, and that's where you need to address your specific asymmetry, because it may not always be both sides that are limited, and it may be more than one thing that is causing that limitation, so keep that in mind too. It's not always just mobility or just flexibility or just motor control and stability. It can be a combination of those factors. So say you did your ankle test was good. Maybe you're still having problems in the squat. You performed it with your feet elevated up, and you're still finding that you're not able to squat comfortably. You're still having some of those faults that I talked about in the beginning. So now let's look at your hips. I'm going to give you 2 simple tests to look at hip mobility. And so the first one here is called the seated hip rotation test. So I'm going to go back onto this seat here and show you this one. So what you're looking for here is about 40 degrees. And again, this is just a rough estimate. It doesn't have to be exactly 40 degrees. And like I said, it's more about looking for asymmetries from side to side, especially just doing this at home. So what you're trying to do is rotate this way. So this is external rotation of your hip, and you're trying to bring your heel kind of up your opposite shin. So you're trying to achieve 40 degrees from this starting point up this way. Now, this one is also easy to kind of compensate by lifting your hip. So we're not looking at hip flexion here, we're just looking at hip rotation, which is there. So approximately 40 degrees or so on that motion, and then hip internal rotation this way, we're looking for around 30 degrees, approximately side to side. And again, we're checking both of these on both sides. And that's just a rough estimate of hip mobility. The next one that I want to show you is a hip flexion test. So this is essentially your ability to, when you're squatting down, you need to have adequate hip flexion in order to get deep down into your squat. So a test for that would be to lie on your back. And what we're going to do here is you're going to have one leg flat, straight out. You're going to lay all the way back, and you're going to try to bring your knee all the way up towards your rib cage. So you're here. And there. So just to break that test down a little bit, what I would be looking for there is, number one, are you able to bring your femur, so the big long bone here, up to your rib cage? That's kind of the test there, is being able to bring the femur to the rib cage. Now, be on the lookout for, can you do that pain-free? Can you do it without any pinchy sensation in the front of your hip? And then also, like we keep talking about, was it different from side to side? Now, based on hip anatomy, some people are going to have a harder time bringing their knees straight up to their chest. Some might have to go out to the side just a little bit when they're testing it. Now, that's completely normal. That's, which I'll touch on a little bit in a few minutes here, is hip anatomy is different for everybody. Although, you know, we all have that ball and socket joint, everybody's positioned a little bit differently. So certain positions may be more comfortable to squat in compared to others. So that is the second hip test there that we're going to look into. And let's go into so maybe you looked into the hip mobility. So you went through, just to back up, we went through overhead squat as a general test of mobility and stability. Then we went into just a body weight squat without the overhead position. We went through and checked our thoracic spine. Then we went into and checked our ankle mobility. Then we just checked our hips, hip rotation and hip flexion. Now, maybe you got through all these steps of the screening, but you're still having trouble and you still haven't found basically a way to clean up your squat by testing all these things. Maybe you passed all these tests so far. Now the next one is maybe you passed the mobility and flexibility components. We're going to look more into that stability and motor control here with this next test. So an easy way to do this at home is just to hold on to something that's stable, and you're going to try to squat down deep into your squat, but with upper body support. So I'm just going to demonstrate this using this rail right here. So you're in your squat stance, you're squatting down and coming back up. So what that can do is give someone that little bit of extra core stability that they may be lacking, and maybe they feel much better. They're able to keep an upright torso. They're able to get nice and deep in their squat. They feel more comfortable. They feel stronger. It may be related to some deficits in stability while weight bearing. Another more difficult test that I would recommend beyond this one to test your motor control and stability would be a single leg stance test, or potentially even a single leg squat test. So I'm just going to demonstrate those real quick. So you'd be standing on one leg, and what you do is raise the opposite knee so that you have about a 90-degree angle here at your hip, and you're just going to try to hold here first for about 10 seconds. And you'll do that, and then I'll have you do the same thing, test that on the opposite side. Try to aim for about 10 seconds. Say you did that, it was easy. I was able to hold it 10 seconds on both sides. Both sides felt about the same. I wasn't really unstable on one side versus the other. Now, this is the most challenging test, single leg squat test. So, say you're standing on your right leg, and again, this doesn't have to be a full single leg squat, but we're looking here more at like a partial single leg squat down and up. I would perform 3 to 5 repetitions in a row on one side and then do the same thing on the other side. But you're just sitting back and do a little single leg squat there. And what we're looking for in that is, do you feel much more unstable on one side versus the other? For example, say I was on my right leg and I went to squat down, my knee is wobbling a lot. I feel like I'm caving in, I'm losing my balance. versus my left side, maybe I felt, oh, I feel really good on my left side. I don't feel like I'm losing my balance. Those are the types of things you're looking for. So maybe potentially you're lacking some strength to your hips. Maybe it's more difficulty controlling the motion on one side versus the other. So that's kind of the final test of the self-movement screening. So bringing all those things together, you may have found multiple things that you need to work on. Most of us do have multiple areas that we can address to improve, to be able to improve our performance and reduce injury risk. Now, with that said, we can have, like I said, there can be a mobility limitation, there can be a flexibility limitation, there could be a motor control limitation. Many times there's more than one thing going on. So that's why it may help to do this screen, get a little feel for what you might find, and then maybe reach out to a physical therapist that you know, and let them know what you found on your self-movement screen. Maybe get some tips from them on some corrective exercises to address those things. Because then the next step would be, okay, I found one side versus the other was more unstable, or I found that my ankle was more mobile on one side versus the other. Now, how do I address that? How do I improve those things? And that would be done through a corrective exercise program addressing specifically what you found for you. Because like I said, everybody's a little bit different. What we want to get into, one last thing here before we go to questions, is just some quick tips and advice to improve squat performance. So in addition to addressing those things that we just looked at, some things to keep in mind while you're squatting, especially at home, while you're doing these things. Gyms aren't open, you may be limited with equipment, things like that. But just some common things to keep in mind when you set up in your squat stance. So this can be a body weight squat, a goblet squat, a front squat, a back squat, an overhead squat. Whatever you may be doing at home, I want you to think about your foot positioning. So many of us kind of have whatever we prefer. Some of us have more of a wide foot position. Some of us have more of a narrow foot position. Some of us have a really far toe out position. Some of us like to have our toes pointed forward. And so I would say one of the biggest things that I've seen is a lot of people think that you have to have one specific position to squat in, that there's one right position. And I would say that's not true, because we are all built just a little bit different. We do have, our ball and socket joint of our hip. However, each joint for each individual is positioned potentially a little bit different. Therefore, some people like a narrower squat stance, some people like a little bit wider, some people like to point their toes out a little bit more to more comfortably get back into a deep squat. So you have to kind of mess with that just a little bit to feel out where you feel the most stable, where you feel like you can access the most joint mobility through your hips, your knees, your ankles, everything. And just, if you haven't squatted a lot, you might have to just mess with that positioning to get comfortable, especially before you load up in weight. Make sure you're comfortable with the position you're using. Now, just in general here, an average I would say is most people stand hip or shoulder width apart. That's about average. And then the toe out angle on average is about 5 to 7 degrees. Most people are within that range. Now, like I said, there's going to be some variation to that, but in general, hip to shoulder width apart, and then a slight toe out position. And another point I'll make with that is that's going to change based on anatomy, but it's also going to change based on your force production. So if someone's trying to utilize certain muscle groups a little bit more, you can also alter your positioning to use more of a quad dominant squat versus a glute dominant squat. And that's also going to depend on what your goals are and what your restrictions are. So if someone is limited in mobility and flexibility, they're probably not going to be able to go right into squatting to full depth or below parallel, which is okay. You start with where you're at, you do accessory work, and you start to slowly progress that squat. So the other component to this is we need to always be thinking about, was it my mobility, was it my flexibility, was it my stability that's limiting that position when we're doing those things? And also take into consideration your goals. If you're an Olympic weightlifter or a power lifter, maybe you're looking to, so a lot of Olympic weightlifters are having to squat very deep because they want to catch their lifts in a deep position. So it makes sense to practice your squats, your front squats, your back squats, your strength work with where you need to catch the bar, for example, in a clean, which is usually deep down into that position. Whereas if you're just going for working on general health and fitness, you probably don't need to go butt down to the ground. You don't need to get as deep as possible. I would recommend getting down close to parallel, but it's not necessary that you're always going down super deep. It really depends on your individual goals that you have moving forward and what you're looking to do with that. So a couple other points. When you're squatting, feet stable on the ground, think about creating a tripod base. What that means is you have 3 points of contact with your feet. Almost think of your feet as hands gripping. So you want to have the ball of your foot, the outside portion, pinky toe right there, and your heel all staying in contact with the ground throughout your entire squat. So when you're squatting, we shouldn't be so far forward that we're coming up on our toes or so far back that our toes are coming up. We want to keep a nice stable 3-point position contact and lock that into the ground. Almost think about rotating here, locking in, gripping in, and that helps engage your glutes here, the posterior chain. And that's really going to help you improve muscle activation throughout the movement. It'll help you move more weight in the long run. And it's also safer to do so to get those muscles engaged. A lot of people will say, weight on your heels, weight on your heels. A lot of people use that cue for people who are going really far on their toes. Now that doesn't mean you want to be completely on your heels and have your toes floating in the air. You actually want to create that tripod stability base. When you're squatting, you want the weight of the bar to stay right through the middle of your foot. So no matter what squat you're doing, front squat, back rack squat, overhead squat, body squat, or goblet squat, you want your weight to stay right over the middle of your feet. That's going to be the most effective, the safest way to do that. The last point I want to make is in regards to braced breathing. So breathing is huge when it comes to exercising, and especially when it comes to doing some heavier lifts. For those of you who are training maximal lifts, like doing some weightlifting competitions, maybe you do a lot of powerlifting and you're back squatting a lot. But even just for the general population who's trying to work on just squatting and keeping healthy joints and doing prehab type exercises to promote longevity and health. What we want to do here is create 360 degrees of pressure here when we're going to squat. So anytime you're in motion, you're into a somewhat braced position. So you're not, what can happen is, especially under heavier loads, is if you're breathing while you're in the bottom of your squat, for example, you're likely maybe going to lose some of that tension and positioning. Your pelvis may shift, and that may put you at an increased risk for injury. Now, like I said, it's good to practice that under light loads too, because you don't just want to practice that bracing when you're under a heavy load. You want to practice those mechanics all the way throughout everything you're doing, so that way it carries over. Your light lifts should look just like your heavy lifts, engaging those core muscles there, taking a nice deep belly breath, bracing here, paying attention to your pelvic position so you're not super far forward here at the start, but you're braced there. And then when you have that breath, you can drop down into your squat and come back up. If you're doing multiple reps, regain your breath at the top. So say I'm doing a back rack squat here, I brace, I squat, I come back up. Okay, I need to take another breath. I brace again before I squat down again. So those are just some key points to keep in mind while you're squatting to help promote pain and injury-free squatting, and to also improve your performance while doing so. So I think that's all I had for today. So what I'll do is open it up to any questions that anybody might have as far as maybe performing squats at home, or if they have any other questions about the self-movement screening. I know that's a lot of info that I just threw at you. It's tough to get all that information out over a Facebook Live, but it is a very useful self-screening technique to look joint by joint. The confusing part may come in trying to decipher what is actually limiting you when you do the test. Whether it's, is it my muscles that are the flexibility is limited? Is it my joint that's not able to move well? Is it because I can't access that motion even though I have it? And that's where it might be beneficial to come in and get a free movement assessment done so that, you know, a therapist can kind of look at and move you passively through a range of motion where you kind of completely relax, and we try to move your joints, muscles around and determine whether you have that mobility and flexibility or whether you don't, and then also breaking down some of your movement patterns. So does anybody have any questions? And so I'll just my email again. I shared this last week. It's rfitzpatrick@corahealth.com. If any questions do come up that you think of or that you just didn't want to ask over the Facebook Live feed, but you'd like to follow up with that, you're welcome for the tips. But just reaching back out to me at any point, I would love to talk with you, chat with you, figure out ways to just move well at home during this time. And especially the big thing I want to point out too is if you're having any pain while squatting or doing any of these movement assessments, go ahead and be proactive and go see a PT. At the very least, most PTs are going to want to talk to you about that kind of stuff, and they're going to offer most likely a free movement assessment. Just at the very least, you can come in, get some advice, some education, figure out, and then you can determine whether you think, you know, PT is the way to go, or whether you know, you want to just go home now and work on what we talked about, maybe some accessory exercises that a physical therapist provides. You know, there's many different routes to go, but it's good to get after these things now rather than just kind of hold off and, you know, that nagging little ache or pain that you have, so that doesn't become worse down the road, and that you can continue to move pain-free, because we should be able to move relatively pain-free. It's not normal just to have pain all the time. Some aches and delayed onset muscle soreness, that type of thing is normal, but dysfunctional pain that's could it be even affecting your everyday life beyond your exercise, definitely go in and get that checked out. All right. So definitely went over in time, but I appreciate everybody joining in. Hopefully I'll be on another Facebook Live here in the next few weeks. But again, I appreciate you joining in. My name is Ryan Fitzpatrick from Wilmington, North Carolina. And again, reach out with any questions. Thanks everyone for joining. Have a good rest of your afternoon.